Dr. Bini, thank you for taking the time with me.
So glad to be here.
Yeah, I mean, you are a pioneer in digital health. You've really been
you.
around this conversation a long time, and here we are at this event, StartUpHealth Festival at ViVE, in person again.
Yes.
Why do you think it's important to gather in person to push some of these health innovation ideas forward?
Look, that's a really good question. Logan, we went from in-person technology conferences at a time where we're still talking about the potential future application of the most basic technology platform we have, which is telehealth, that's been around for 15 years. Fast forward 2 years, telehealth is now it's not even a question mark. It's established, it's going, it's providing care everywhere. And the adoption of these technologies, but also their promise, has been made clear. Now, you asked me a different question though. What's the difference before and after? Now, you guys like us at DOCSF, Digital Orthopaedics Conference San Francisco, went virtual. And as a result, we reached a lot more people. We went from a few hundred to a few thousand people watching programming. But as the years progressed, I realized the magic was missing. Because so much of what we do isn't necessarily educate people. It's to see the conversation. It's to bring forth an idea and challenge it and build it up and show where it can go and adding our 2 cents. That only happens in person. I haven't seen a platform that's virtual allows us to do that.
Quick question, relate that to the actual practice of medicine, because you're a physician.
Yeah.
So in education and a conference, there's magic in meeting together person to person. And we also talk about remote monitoring and virtual care, telemedicine. What are some of the aspects of the magic of that we still have yet to sort of tap into virtually?
So, where there is a conversation that has to happen, where there is an exchange of ideas, the ability to jump into the conversation at any point in time in different points of the day isn't available when you're stuck in a specific time frame where you have a conversation online. There are going to be improvements in the interface, right? We know we're not there yet. We're comparing dial-up banking to what we have today in terms of what we're going to be with telehealth. And some of that will be recaptured. But the magic I was referring to, which is not specific to education. Education is a whole different battlefish here. This is innovation. Innovation is a series of happenstance circumstances that occur where ideas build on other ideas. Some people have said there's no such thing as a new idea. You're always building on connectivities of other ideas. Something I love to talk about is the concept of innovation being based on adjacencies. So, and you're very familiar with this concept, the idea that when certain things are available that enable a third thing, that third thing will happen because the adjacencies are there. But if you're trying to build, I don't know, some technology company that requires online payments, if you don't have the online payment platforms, you can't build it. You can think of it, but you can't build it. The adjacencies don't always come to you in a platter. They come to you in happenstance. You happen to talk to someone, I didn't know you could do that. Oh, because you can do that, now I can do my thing. Let's do it together, let's build it. That happens organically at a conference like this.
I know it's early for you to start, culling through your insights, but you've been doing a lot of interviews, a lot of panels, you've been meeting a lot of people. Anything at this event start to grab your attention, kind of brighten your eyes about what's possible?
Yeah, so a couple of things. One is that the mood is one of possibility. This is a group of people who have been struggling to prove their point for about a decade. And now they feel like they've been validated. And the energy, the positivity, the feeling that this can be done, we really can do this, is much brighter than it has been in previous years. Another thing that as you go around here you see a lot of is the whole concept of getting past the data interoperability quagmire or problems. So what I'm seeing is a lot of really good solutions that get us past that point of data sharing and then be able to build on that data with the AI technologies that show all this potential for predictive and therapeutic analytics. So I think that's the overarching theme that I'm seeing.
I talked to a founder this morning, and he wasn't trying to rebuild the foundations of, like, let's say, patient engagement software. He was building on top of that foundation, filling in new gaps that have formed because of the first generation. So kind of what I hear you saying is that if that interoperability foundation is firm, then we could start creating these more specialized solutions on top of the first generation.
Yeah,
Is
I
that
think
what
that's
you're
a
saying?
very good way of stating it. And the interoperability concept is something I've been trying to find the company that's doing it from a what I call the Internet of the operating system of healthcare, which would sit over a database called the health record, allow us to plug in our APIs, and then have not one solution for a given problem, but a dozen solutions if you're a healthcare system. Why do you have to limit your physicians to the one solution your IT team picked? Let the market figure it out. Give them 6, so long as the data is transmissible between each app, and when new data is collected, it's also written back to the record. There are companies trying to sort that out, but that wasn't true 2 years ago. They were not there. So now that's what I'm saying. We get past that spot, then everything blows up. 2 more years, and we're going to be really, really excited about it.
So you've been coming to events like this, just health innovate. Well, there might not be events like this in the past, but health innovation events, collections of people like this. And I'm kind of wondering if there's things that you're seeing now that surprise you when you think back to what you thought was going to explode, what was going to take off and have legs early in the digital health revolution, and now you're here. What sort of has played against your expectations? Or has it played out just as you would have hoped?
It's an interesting question. Being on the clinical side, right, being a practicing physician and knowing the challenges of deploying technology in healthcare, I think that the pace of change is right about where it probably should have been expected to be, but none of us hoped it would be. And I think what I mentioned earlier about data interoperability is going to be one of those linchpin moments. Once we break that lock, I think we're going to be seeing some of the evolution that we're waiting for, but until that happens, it's going to be tricky.
How do you see that playing into your own practice? Let's say that does get unlocked and you're able to use new tools that are really still in their infancy. You're a practicing physician. Where do you hope to be in terms of using health innovation tools in your own practice a couple years from now?
So where I see the potential in the near to midterm for me as the CTO of the department, so really looking at the patient experience, is being able to identify reverse engineer. So look for the pain points in my practice. Right now it's surgical schedule cancellations. The next thing I want to tackle is pre-authorization. These are real pain points in my actual practice, and it may seem small, but they have massive repercussions in our ability to do work. The other one, of course, is the ability to manage data in the health record and data entry. So whether it's virtual scribes or other similar things. What technology can make my life easier, allow us to scale our care to larger and larger populations with a smaller and decreasing number of caregivers in a way that actually solves the patient's problem. So that's where I'm looking at it. But if I have to create a complicated FHIR integration into Epic every single time, and my IT team at Century doesn't allow me to do that, it really slows down our ability to implement. So once we get past this interoperability piece where I can plug in a place where the IT is happy that it's going to be cyber secure, and I'm not creating a leakage problem, and I can then really let the technology speak for itself. That's where I want to get to.
What I'm kind of hearing you say is sort of like an app ecosystem where you're able to easily plug in a solution that's very targeted to a specific problem. Because no one's going to come in with sort of the one-size-fits-all solution when you're talking about my type of surgery, my type of scheduling. So you're hoping for
my type of patients.
Your type of patient, So more targeted, more personalized.
Or the ability to target and personalize. Absolutely right. So like you do on your phone, you and I will both have similar types of apps, but different ones. Why can't I do that from my healthcare system?
Awesome. Dr. Bini, thank you for taking the time with me today. I hope that after this event, you're able to, bring all your thoughts together and write it down so I can hear and learn more about what you've seen.
Awesome.
But thanks for the work you keep doing.
Absolutely. Thank you, sir. Great to see you, Logan.